You're listening to Catalyst for Change, and my name is Jessica Huckabee, your host. I started this podcast to learn what makes people resilient after challenging events and how they've used those series of events as a catalyst for change in their life. You'll hear stories of resiliency and strength, so get ready, sit back, and be prepared to be inspired. Today, my guest is Francisco Oller. He's a public speaker and influencer on social media. He's learned to overcome challenges at a young age since he was born with a physical disability, and he feels that life is not about what happens to you, but how you react to it. Thank you so much, Francisco, for coming on my podcast, Catalyst for Change, Stories of Resiliency. And can you start off by just telling me a little bit more about what was the catalyst for change in your life?
Definitely. I think one of my perspective is a little bit different because my catalyst for change came from the day that I was born. So when I was born with a physical disability. And growing up, one of the things that I remember asking myself was, one, why did this happen to me? But two, and I think the larger question that we all ask ourselves is, what is my purpose on this earth? What am I supposed to do? And how can I have an impact that goes beyond me? So being born with a disability has shown me how kindness and empathy and compassion can really resonate, but that it all starts by having a grateful heart. Because if I think about all the accomplishments and all the different successes in my life, they've been because somebody else has invested their time in me. They have seen the potential that I have in growing. So what they've taught me, not just to be grateful and to share kindness, but it is that challenges are truly opportunities to thrive. If we think about our lives and a lot of the things that we're good at one point we weren't good at them and we thought that they were a pain, but now there's something we love to do and it has become our expertise.
Yeah, I love that. That's a really good way of looking at life, and a good way of looking at those challenges as well. And do you mind me asking what your physical disability was that you're born with?
Yeah, absolutely. So what I have kind of affects my ability to walk. It's in the leukodystrophy family, which basically just means that, which is a big scientific, not a scientific term, but it's like a medical term. But
Yeah.
in all it does is it affects my balance. So when I walk, I have to walk with like leg braces and crutches. And if I want to move around, or the way that I'm primarily move around is in a manual wheelchair. But the cool thing is that no matter where I go, I'm always on a roll and I never have to find a seat.
Yeah, there you go. I like that. Good way to look at it. Very positive way to look at things. So tell me now, what challenges did that present you growing up that you had to overcome?
I think in terms of challenges, it's always thinking about, and it began with this mindset shift, right? I think the biggest challenge was seeing opportunities and seeing the possibilities and understanding that there isn't, that I'm no different. It's just I have to maybe maneuver my way to do the same things that other people do. But what that does is, I remember when I was in college up in Rhode Island with the snow and the hail and everything, that I learned, that I knew a bunch of shortcuts and a bunch of different ways to get to places faster than people because I had to really think about my day-to-day routine. So that's one thing, right? Is like when I go to work, when I do these different things, I kind of have to map it out and plan it out, just
Yeah.
because there's some things that I have to account for. But nothing. It's no big deal. And I think the other challenge that came into my mind is, when I interact with people, how can I cut the tension? How can I make them feel comfortable when I'm
Yeah.
talking to them? Because we want to, in everything we do, and this is so important for me, is I want to create an environment that's very open in communication. And so one of the things that I'll do, like whenever I'm talking to someone, I'll just make like some joke or some pun. I'll be like, oh, like don't you want to look for a chair or something? Because you must be getting tired just standing. And the person, like, you can just see like the whole tension just like go away from
Yeah.
their face. And it's truly because my disability, my physical disability is a part of my life, and it has given me this unique perspective, but it
Yeah.
doesn't define me. I define it.
I really like what you said because it's, I feel like we have to take ownership of feeling comfortable when somebody has a disability, and you spin it around to where, I mean, I'm thinking we have to be inclusive. We have to make sure we think outside the box and accept everybody, but you're actually spinning it around to say, you know what, I want to make other people feel comfortable, even though I'm the one that has the disability, and, they shouldn't be looking at me differently than anybody else, but you're trying to make them feel comfortable.
Exactly.
Yeah, that's really interesting way to look at things, and a very positive mindset to have, which it seems like just the short amount of time we've been talking, you seem like a very positive person.
Mhm.
So have there, so throughout those challenges, what have you been able to do to help others that may be in the same situation?
I think one of the things that I learned from an early age is to not feel like you're on an island, and to share your story and to share it in a way where others can become a part of it. So I remember when I was in college, which wasn't too long ago, one of the things I first did when I came onto campus, I put on the first student-led event, the first inspirational speech event. And what was so awesome about that is, um, we had booked this room, and an hour before the event, it was entirely full, and we had to scramble to find a bigger space for
Yeah.
the speech. So that's kind of been, my goal, my objective, because my personal why is to reshape what it means to live and thrive with a physical disability, to empower others to live life with self-acceptance and courage. So kind of touching about that, how we were talking about before, about creating that inclusivity and really empowering people to be strong in their beliefs and in who they are. Because the truth is that for a lot of people, you inspire them by just being you. And you may
Yeah.
never know that because people don't express it. But I think that's a cool little thought to have in the back of your mind. And that's one of the things that I champion in my speeches or whenever I'm talking one on one with a person. Because the truth is, yes, it's great when I get to talk to a crowd of, 100, 200, 500 plus people.
Yeah.
But creating greater impacts starts with just one person.
Yeah. So tell me about some of the public speaking that you've been able to do.
I've been on National Public Radio. I've been on Telemundo, on live TV, which is an awesome experience, as well as going at speaking at various universities such as Providence College, the University of Tampa, Duke University. And in each of these experiences, what I found is that you can impact people from all walks of life, but at the same time, I'm impacted by the audience and I'm impacted by their questions. And they're truly the thing that motivates me to keep doing what I do, because I know that no matter what, our time on this earth is limited just because we're human. But if we leave a legacy that goes beyond us, then we've done something that's purposeful.
Yeah. And so you mentioned that I saw in your profile that you're working in healthcare. Can you tell me a little bit more about what you're doing in healthcare?
Yep, absolutely. So I work as a digital marketing and operations specialist for a health tech company in the insurance space. And what we're doing is we're working with employers and health insurance advisors to design innovative and forward thinking solutions that improve a population's health and drive savings year over year. So essentially, what resources and how can we improve a health plan so a person is able to improve their health and as a result lower their costs, which in turn lowers the cost for the employer.
Yeah. So everybody wins. Now
Exactly.
Tell me what, so it sounds like you have a rare experience that they maybe are a unique experience that they may be looking for in the healthcare field. How are you, what changes do you think need to be made in the healthcare industry in order to better help people in general or people with a physical disability? Do you think there's changes that need to be made?
I think overall, I think the biggest kind of change that needs to be made, and is something that the company that I work for does, is incentivizing and rewarding people for their health. So one of the things we do when we work with employers is we have a deductible incentive program. So employees go and get a basic a biometric blood screening, and based on certain biomarkers, they can lower their deductible by thousands of dollars. So what it does is, for those individuals who are healthy, it helps them, like, yes, it's kind of like that, a good behavior, right? Like, I'm doing what I'm supposed to do, and now that's being reflected somewhere. And for those who are not in the optimal position, we then give them resources such as health coaches and one-on-one functional medicine doctors to help them get to where they need to go. I think the biggest thing is that we need to help people be true consumers of healthcare. Because if we think about any other industry or any other thing we buy in our lives, we're always doing comparisons on price and quality. But when it comes to healthcare, we just kind of go with what is the first recommendation or the first suggestion that is made to us, because it is a complex maze to navigate, and then there's all the financial implications. When we think
Yeah,
about that, 66% of bankruptcies in the US are due to medical bills.
yeah,
That is staggering. But
yeah.
the real staggering part about that is that the cost of healthcare is what's hindering people from getting the care they need, which will, as a result, not not escalate their current health conditions and or completely reverse them.
Okay. Now, what if people are, they have a disease or something that's wrong with them that can't really be fixed by health coaching and that type of thing? Is there something that they can do, or somebody that's gotten in a car accident or some accident or some kind of disability that's happening with them?
Definitely. So when we work with employers, there are different programs for case management, disease management. And basically what that is that you get more specialized care, more specialized treatment. You may have somebody that works one-on-one with you to really help maintain your current health condition. Because it is true, right? Although about 80, I think it's a statistic from the CDC that says like 80% of chronic diseases are reversible. There's still a wide array that aren't, right? And
Yeah,
we need to help. And I think that's where it comes down to helping people, whether it be through primary care or more specialized programs, really maintain their health.
yeah.
Because at the end of the day, healthcare doesn't just impact the person, it impacts their spouse, their children, and their family.
Yeah. And the employer, if they have to pay more, and the community, if they have to, because we're all in this together, it feels like. So, yeah. Well, wonderful. Well, what are your plans for the future? It sounds like you've graduated college a little while ago, and now you're in this new realm of healthcare. And yeah, what are your plans?
My plan, so I started really building upon these plans this year, and one of my goals was to be a community thought leader. So one of the things that I've been very purposeful in doing is getting involved in the community and getting involved in different capacities. For example, I'm the marketing chair for the Board of Counselors for the University of Tampa. So I'm working with fundraising initiatives and also the different how to connect deeper the young alumni base of the university. I'm
Oh, interesting.
also in the Emerging Leaders of Tampa Bay, where I am a part of the inaugural collegiate leadership program. So I'm going to be matched with a student from one of the local universities, and I'm going to be mentoring them one on one.
Oh,
And
nice. Yeah.
so those are two of the things that really, two of the organizations that I'm really deeply involved in. And I'm also looking at the possibility of joining the board of a nonprofit as a board member, because I think it's so important that it's, our personal and professional lives are so intertwined. And the more we can create synergies between them, and the more we can really be a part of societal impact, then that makes us feel more accomplished. But in the reality, what we're doing is we fuel each other forward. And the more we do that, then we're creating greatness.
Yeah, and you feel more connected if you're able to be more involved in, and link the personal and professional life together, it sounds like. Yeah, wonderful. Well, thank you so much for your time today. Now, is there anything that you think we may not have touched on that you want to make sure that listeners know about?
I think the one thing that I would like to touch upon, and this comes from, well, it's two tips. One of them is, no matter what you do or what you're selling, what you're ultimately offering is you. And that quote is from Bob Berg, the author of The Go-Giver, who's one of my favorite authors. And I always like to think about that, right? Like, whenever you want to work with someone or you buy something, it truly is, you're thinking about the person that's there. And if if a problem comes along the way, are they that kind of person who will answer the phone and answer that call?
Yeah.
Two is, I know I said two, but I think I'm going to go with three.
Yeah, go for it.
Two, I had the honor of seeing Sarah Blakely talk this year, and she's a creator of Spanx. And she said two very powerful things. One of them was, self-doubt is going to be an ever-present force in your life. But when you have a why that goes beyond you, then you're really able to put those fears away.
Yeah.
And then what she said next really took it another level. She said, a lot of people say business has to be war, but I say, no, it doesn't. And I'm going to honor that path. And that's something that I think we should always try and look for ways that we can partner and we can work together. Because if we think about a lot of the greatest accomplishments in life and a lot of the breakthroughs that have been done, they've been done in collaboration and in teamwork. And
Yeah.
those are kind of the three things that I kind of wanted to touch upon, is how no matter what we do, what we're offering is us.
Yeah.
To the value of having a why that goes beyond you. And three, honoring a path in business that is about collaboration and partnership and not war.
Yeah. No, that's the new way to think about business. I think that's a wonderful perspective. And yeah, she's one of the people I really like to hear from as well. Well, thank you so much for your time. And I really enjoyed talking to you and learning more about your story. And I look forward to hearing about or following you on LinkedIn and seeing all the great stuff that you're going to be doing.
Thank you so much, Jessica. It was a true pleasure. And for whoever wants to connect with me, please feel free to do so. And remember, you're braver than you believe, and stronger than you seem, and smarter than you think. And that is my favorite quote by the writer of Winnie the Pooh, A. Milne.
Very good. Good quote to leave on. Well, thank you so much. And I'll have all your information in the show notes.
Thank you.
You've been listening to Catalyst for Change, and my name is Jessica Huckabee, your host. Join us next week for another story of resiliency. And please subscribe wherever you listen to your podcasts, and feel free to leave me a comment or email me at catalystforchange20@gmail.com, or on Facebook, we have a page at Catalyst for Change Resiliency.